precision medicine is a catch-all term for what is essentially an extraordinarily complex process. I mean, we have to remember that cancer is, to quote a phrase, the emperor of all maladies. And it's the emperor of all maladies for a reason, and the reason is that it's rapidly transpiring that no two cancers are the same, but worse still, no two cancer cells within a patient's tumour are the same. So when thinking about precision medicine, I think it's helpful to think about how tumours evolve and change over time. And one of the ways they do that is through a process called branched evolution. It's not the exclusive way of tumour evolution, but increasingly we're seeing this in advanced solid tumours. And so when you think about branched evolution, every branch has a trunk, and the trunk is they're essentially the early founder events in the evolution of a tumour. So the early driver events, such as epidermal growth factor receptor mutations, that drive the tumour growth. And then you have the later mutations, which are the branch mutations, which occur in some cells but not others, or some regions of the tumour and not others, or some sites of metastatic disease and not others, that a single biopsy might miss. And we're trying to understand in a research setting what the scope and extent of that diversity is, and also what's driving that diversity. But for precision medicine, I think to reach the sort of the ultimate limit of precision, we have to think about moving forward from defining what we see in the clinical setting, which is this concept of an actionable mutation, to thinking about actionable mutations within the context of what we call heterogeneity, or that diversity, where that actionable mutation may be present in some cells but not others. To achieve maximum cell kill, at least in the early days, before we understand better how cells interact with each other, I'd like to see trials designed where we're targeting an actionable mutation that's present in every tumour cell, so the trunk of the tumour's evolutionary tree. So at UCH, what we're working on are clinical studies that are set up to understand tumour evolution and then implement that knowledge more precisely in the context of personalised medicine to generate new clinical trials where we're targeting those truncal events to see if we can improve outcomes.